happening. It's happening. All right. Hey everybody. It's Dr. Ashley, pediatric emergency mom, and I'm here with my good friend Claire,
Hello.
who has joined us. So Claire is a physical therapist and is amazing. And is mom to two adorable kids,
Yes,
an
they are.
8-year-old and a
She's five. Yes, she's five.
5-year-old.
Five going
Um
on spicy. Very spicy.
that way since she was like
She was.
little bitty. Yeah.
Even nonverbal was very spicy. Yep.
They learned, like they know how to communicate. They will make you know. Um, so Claire's a physical therapist, and I will share her links to her some of her videos
Oh yeah, yeah, yeah.
on the Facebook group. But you do amazing videos on so many things. So and a lot of things that I probably even haven't caught all of your videos. So like talk me through how you came to even do these videos.
Okay, that's good. I always say, like, when I'm like giving lectures or anything, I consider myself a physical therapist with an identity crisis, because when we think of what a physical therapist is, we have some of us are like, oh, I've been to a PT maybe after a surgery or after an injury, or oh, a loved one has done PT after a stroke or something like that, and I very quickly, as I sort of developed as a clinician, I realized that I did not necessarily fit into, the different molds that exist. And that's, typical of a profession, right? We have these entities that sort of exist. But the thing that I gravitated the most towards was, one was manual therapy. So I do a lot of hands-on. I feel like I have kind of a gift for that. And so what was hard for me is being in a clinic where the limited time that you can be hands-on. And so I was having to like figure out, how do I accomplish a ton in a short period of time, and then get them going on exercises. But maybe in the back of my head, I'm thinking, God, I don't know that they need to be doing those exercises, or if they're doing it, I need to make sure they're doing it really well, because otherwise, why are we doing it? And so I think we think of PT as like, oh, therapeutic exercise, which is great and super important. What I have kind of become is sort of more of a mental health practitioner in a certain way. I started gravitating towards like teaching people about pain, like and understanding what happens in their body and why they feel pain, right? And why pain feels bigger in some ways and less in others, and why there are people walking around with degenerative spine but have no pain, and stuff like, and but then someone else is in raging pain without a lot of evidence on their imaging and stuff. And I think what it came down to is I was actually kind of seeking out, what manual therapy, direction should I go? And what it kind of came down to is, well, all of these manual therapy tracks or theories, their target is helping someone out of pain. So I'm like, well, if I understand pain well enough, I kind of can create my own, theory, I guess. And then it just sort of took off. I was like, this is the answer, right? This is the missing piece. And not only, what I realized is, even in my profession that maybe even spends a little bit more time navigating pain, it did not cover pain in a way that we know and understand it now, and how we teach patients about it and stuff like that, which is sort of this like the neuroscience of what happens in my nervous system in response to a threat, either in my environment or internally in my body, right? And the truth of the matter is that your brain is the sole decision maker to create an experience of pain, and it does so as a way to alarm you and generate some like, oh, I need to move, or I need to get out of this harm's way, or I need to do something different to get you out of that pain experience. And so I think I became kind of very invested in sort of the opioid crisis, and I think that's been really tackled as well as it can be, and people are still talking about it. I think the underlying of that, though, is that we truly don't understand pain, and not just. I don't want to say that physicians don't understand pain. I think that in general, healthcare providers have a very basic, superficial idea of pain, and so when that's the case, then we're willing to uh, prescribe medicines that may not be the right medicine, or procedures or surgeries, or, and so the videos and the sort of came about as this idea of like, we have to be better at explaining things to people who don't have our background, right? I
Hmm.
think there's an assumption in healthcare, and it has a lot to do with how much time us as providers are allotted with patients, right? Changes in insurance. I'm not getting paid as much. I got to see more people. That's less time. So how can I deliver a quick enough message that they sort of get it, and then they get out of my clinic, right? What that generates, though, is a fear. It's a more of a fear around a specific diagnosis. When I know just a little and not enough, what I end up doing is I go to WebMD, or I go to, my first thought goes to whoever I know in my life that has that diagnosis. And man, they have been on disability, they can't walk, and here we go spinning, right? And so my goal, and I think like my intention for 2025, it just kept coming to me, is this idea of words, using our words better, having the thought and the confidence that someone can understand what's happening in their body, and when they do, what's happening there in their body becomes less threatening to them, and we become better at managing the diseases, disorders, diagnosis, pain, all of that stuff, right? So
Yeah. Yeah, and I love when like when we get to work with DOs, so doctors of
yeah,
osteopathic medicine, because they bring a whole different
yeah,
set of tools to the table. And even in seeing kids, in seeing adults, and even I just personally worked with an emergency medicine resident in December, when like I my neck, it's a whole, we'll talk about
okay,
that. And she was like, well, we're not busy right now, why don't you, let's go in a patient room and I'll do an occipital release, I think is
love
what,
it. Yeah,
yeah. And I was like, you're the best. I'm like crying. I'm like, this is the best I've felt
yeah.
in so long. So yeah, I mean, because I can't take fistfuls of ibuprofen,
Right.
nonstop. So then reaching for alternative ways
Yeah,
to treat pain. And what you said too really resonated as far as understanding
yeah,
pain. And we have in the pediatric world, we're not doing a whole lot of opioids. I'm definitely giving it if a kid breaks something, right?
yeah,
Like,
sure.
you have a broken bone, you
Right,
deserve
right, right, right.
something. But all of those ancillary therapies to the ice packs, the
Yeah.
elevation, but one set of patients that we use it quite often are our sickle cell patients, for example,
Yes, yes.
in their vaso-occlusive crises that they grow up having, especially if they're SS. But even so, I had a teenager a couple of years ago that I saw and treated pain, felt better, had a conversation about how what meds you should take, and alternating in that pain crisis, alternating your narcotic and your
Yeah,
NSAID,
right,
overhydrating. I tell them overhydrate, like
right.
hyperhydrate during this time. And he came back to the ER hours later. I'm still in pain. And I realized, and I told him, I said, I apologize because I don't think I explained, like, I didn't use my words well enough to explain to you. And now I realize that you're a teenager now and you still don't fully understand.
Oh,
So a lot of people have missed the boat on, it's one thing to explain, like, this is why you're in pain. Your blood
right,
cells are sickling and they're
right.
clogging up your blood vessels, and it's, ischemia to your bones, your muscles, your tissues. But it's another thing to sit down and say, like, what I'm telling you to take will not fix your problem.
Yeah.
Your pain will continue. And it took that, and it was a, and I told him, I said, this is a lesson for me too. And the
I
way that I have these conversations. But I said, and the way I explained it is like, we're not aiming for a zero pain, because
right.
that's not what's going to happen for you.
Right.
We're aiming for, if today you're at an 8, then by the end of the day, can you get to a 9?
Right.
Or sorry, can you get to a 6
Yeah, yeah,
and then a
yeah.
5? And
Right.
then, because especially for those complex kids, like, it's it really is a marathon for them.
And I would say so two things. One, the fact that you were able to repair with a client and be willing to say, I'm really sorry. I don't think that I don't think that exists in in healthcare, in parenting. Like that is a really remarkable gift that you gave him, and that's the recognition that we as healthcare providers are we make mistakes, right? And
Yeah,
that is hopefully those mistakes are not life threatening in any form, but like to recognize, hey, like okay, I didn't say that quite as well, and it reminds me of, like, I would be in the clinic, if I was when I was still working in the clinic, I would get patients and they'd say, my doctor said this, and I'm like, what? And I'm like, and then I'm thinking, I'm like, there's no way the doctor said that. And but the recognition that the way that someone is interpreting or hearing something,
right.
that's all right, may be different from what we actually said, right? And
Yeah,
there's this whole, in the pain science world, the big guru, one of the big gurus out there, like, was like, we have to, like, the number one thing in pain science is to sit back and say, okay, can you tell me back what you heard that I said, right? Like, it's this sort of like, I can sit here and say and nod and say, what I mean? Like, and of course people are like, I do, but do you, how do you say it back to me? And so I think that's really important. The one thing about opioids is that they have very specific uses where they are very good. And what you described is one of those. And I would say really acute, either post-op or in, major injuries like fractures and stuff, and in a very short term. What we are hoping starts to, like, a trend that picks up, is that we start qualifying pain into different categories, whether it's, okay, this pain is truly like neuropathic in nature. This is a nerve problem. So my medication, if I'm a medical doctor, my medication is going to be a neuropathic pain medicine, right?
yeah,
And if this pain is primarily inflammatory in nature, then the pain medicine that I'm going to seek out is an anti-inflammatory, right? And if this pain is kind of generated as a myofascial muscular type of thing, then I'm going to seek out a muscle relaxer type of thing. So when we can better qualify pain, then you actually get much better results with the medicine that you are,
right,
providing. And there becomes less of this disuse, misuse, when we're like, well, that didn't work, I need more, or I need, and so if if we're meeting pain where it exists, then we can really help transform that nervous system to be more resilient to, and I think, like, one thing too is that there's this, so kind of speaking to the DO, I always tell patients, like, there is this hierarchy that still exists where the physician is on top, and you know, that's okay. That's how it's been. I think we need to get to the point where you start realizing that there are primary care providers that you can go to with a specific thing that you don't have to go straight to your doctor with, right? And that may not only help your doctor, but it helps you and your path to recovery a little bit better, right? And I still get patients that'll be like, I mean, if do you think I should go, get an image? Do you think I should go to the orthopedics and get an injection as like a first line? And my thought is only if you're also doing all of this other stuff, right?
And
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 only if
all of
you
that other stuff isn't, yeah,
right, like and
you're not
like
moving forward. You're not improving. You're not
as long as you know that medicine and a steroid injection is a
band-aid.
yeah, it's a symptom
Yeah,
uh lower, but
not a
but
cure, right?
but what, like, it's not tackling the core. And so if you feel good on that and you continue about your business on a dysfunctional movement pattern, on a poor posture, or then you're going to do even more of a disservice. And I think that comes from, you know, my type of professions, the more conservative, to be louder about, hey, yes, I don't think an injection might not be a bad idea in some situations, but you also need to be, manipulating, mobilizing, releasing, strengthening, doing all of this stuff and taking advantage of that moment when you feel better with that injection.
Yeah, and I think too in this day and age, and the way we live our lives, is we're trying to cram so much into one day, so much into one week, and
Yeah.
so it's human nature, I think, to just want that quick fix, which is not often
Right.
the
Yeah, I think the
the
hardest
thing.
thing, well, and so what I'm doing now, what my practice looks like now is wellness physical therapy. So I'm not seeing patients that come in with a script and a diagnosis. I'm seeing clients who are coming in for body work, body assessment, and like, hey, since last month when I saw you, I've started having a little bit of like, headache type stuff, and I'd like to look at that. So working through these things and, you know, and giving people tools to start to maintain their health over time, and to also start encouraging people that what wellness and long-term health looks like is not constantly taking ibuprofen or constantly like, oh, I need to probably go back and get that injection in my knee because I'm due for it, and starting to like demystify some of those things that we just sort of have bought into over time because we that's what we know of, like, and
Yeah,
um
I love that too, because this is it's why I started the Facebook group and doing my videos. Is I felt like, in pediatrics we do great anticipatory guidance to safety.
sure,
We don't for illnesses.
right,
And so, then this is how you get parents running to the ER or running,
sure.
to an urgent care if XYZ is going on. When if we talked about it ahead of time
Yeah,
and you had that almost handbook to say, wait, 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 I talked to my doctor about this. They said if fever and drinking, peeing, pooping, breathing
right,
normal, then we're
we're
okay.
okay, right,
But we're not doing that. And a lot of it is a function of time limitation,
sure.
probably. So I think that I wish I need to book an appointment with you, but I wish I would have done this like 10 years ago, right?
Right.
Before I started having wear and
Look,
tear kind of.
and I've thought about this a lot too because my videos seem to be very well received, and I'm hearing, oh my, I mean, you explain that in such like an easy way, and I finally get what my bursitis mean, whatever. And I'm like, what my limiting factor was just being so afraid to like put myself out there. Like before we went live, you and I were talking about I just had a recent ADHD diagnosis, and so to be fearful of like criticism about, like, from my colleagues being like, well, she's not talking, she's not going through all the or whatever. And I'm like, you know what? No one else is doing it. I got to do
Yeah.
it. And if I'm wrong, I'm going to come back and say I'm wrong. Right.
Yeah.
And if you need clarity, call me or email me. Like, and I think that this is how we change long-term health, right? And not just pain, which is my, you know, passion. I don't have a passion for pain, but I have a passion for people understanding
Yeah.
pain
No
and
education.
it
Yeah.
not being an epidemic, right? And I think it all goes back to how well we can make someone who does not have our background in medicine and in physical therapy and in neuroscience and in all that stuff truly understand what's happening in their body so that they know, hey, the last time Claire worked with me on this, this is what she said. Okay, if I'm feeling this and I know, okay, I hadn't had any major accident, I haven't had, then this is what's needed, A, B, and C. I'm keeping that patient out of an ER, out of an orthopedic office where they go and get an image. I mean, there are some orthopedics that are like, I can't see you until you get an image downstairs.
Yeah.
Okay, I don't need to get off on a soapbox, but so to not allow a patient to go through this rabbit hole of, I don't want to say mismanagement, but just tiny scraping the surface of
Yeah.
management
Yeah.
to end up 3 months from now with a much worse situation based on the layers that pile on because, oh, that hurts when I do that, so I'm not going to move that way, and now I'm moving this way. And and that is truly what the body does, right? Is we are so good at anticipating this. All right, it hurts when I do that, I'm going to do this, right? And most of us are not aware of what our body's doing, and so we make those little subtle changes without even realizing, and they're not a problem until they are, right? And
Yeah.
that, and that may be in 2 months or it may be in 10 years when you're like, when I'll see a patient and they're like, I've just had chronic neck pain and I haven't been able to move my neck in 10 years. And I think it started when I woke up with a crick in my neck and I just, it got, and I'm like,
Yeah.
so then, I mean, someone reached out to me for that, and I was like, okay, I need to do a video on a crick in the neck, right? And like what you
Yeah.
can do immediately. Like, let's not
Yeah.
have your one sleeping in a funky position end up in 10 years of neck pain, right? And
Yeah.
anyway,
I
so
think, and it's interesting too because so I'm a big believer in massage, and
yeah,
I tell my patients, especially my motor vehicle accident patients, they when they come in and they have neck pain or shoulder pain, and I'm I'll and I teach the residents, like, you have to massage
yeah,
their neck and their shoulders, and I guarantee you most of the time you're going to find a muscle spasm.
yeah,
And so talking to families about, in addition to your ibuprofen, a heating pad, massage,
yeah,
and you have to do the work
right.
on this, right? But I have this massage therapist, Naisha Kelly. I love her so much. I think she's in the group,
Shout
and
out, right?
shout out, she's amazing. I joke that her fingers are like steel. She must have like an adamantium skeleton. She's like Wolverine. But
All
I met her uh, 15 years ago, probably.
right,
And she went to a couple of different like places, and so I got her phone number and I followed her. Like
sure,
wherever she was, I was going. And now she'll do some house visits. Like
love
she'll
it,
bring her table and do house visits. But and she always fusses at me because I should have her come like once every
right,
few months, right? But we're all busy and we don't prioritize our health.
right,
Um, and so by the time I do get her to come, she always fusses at me
right.
like, "You're a mess.
It
You're a mess."
becomes reactive medicine versus, or
Yeah.
reactive treatment versus preventive.
But one of the things she taught me, which is, it sounds so simple, but it was so eye opening, and it stuck with me to this day, is when my back hurts or my hip or my whatever, I mentally check, am I standing straight up? Like, is my weight equally
Yeah,
distributed on both feet, and not,
right.
we do this, especially carrying kids, like,
Oh
we do
yeah,
this thing. And just those simple things that
Yeah,
if we if we're not properly in tune with our bodies and knowing how things go sideways, then like how can we teach our kids
absolutely.
to recognize these things?
Yeah, I think, and look, we talk about things like massage and body work as that's lumped into a luxury category, right?
Mhm.
And what I am hopeful of is those sort of things move into a important line item on your budget, right? And that's going to take work and shifting around and all of that stuff, but I do see that wellness includes a very intentional, conscious body worker getting their hands on you. And well, that looks different. It's monthly for some, that's quarterly for other people or whatnot. But that's important. And giving you the things to do in between sessions. So every person that I see, their home exercise program has very little to do with, true therapeutic exercise, and more to do with, this is what a trigger point is. This is how you release that. These are some pictures of how you can find, and I started doing videos of like, hey, this is how do. And that's what I give them. So that in between visits, say this little thing pops up that's kind of your recurring pain. This is what you're going to do. And I bet you anything that you're going to get yourself out of it. So if we're able to give tools to people that are so tangible and that in an instant they're like, wow, that actually worked. Now I've empowered you to not be like, should I go get that injection? Or should I go get, ibuprofen or whatnot? And so, I mean, that alone is powerful to give tools to people to continue their in between. So that's what my, homework for patients is: lots of nervous system regulation techniques, a lot of like, calming a central nervous system, which is a huge component in our pain experience. I teach lots of like trigger point releases. So, like you were saying, like some of the massage stuff, I even go deeper of like, okay, well, if that's truly in a spasm, massage is going to feel great. But to get that thing to break, we're going to have to do like some sustained pressure on it, right? So, like teaching them, hey, when your back is seized up, please don't run to the doctor. What I want you to do is try laying on a tennis ball or lacrosse ball or whatnot, putting pressure on that muscle that's doing this, seeing if we can get it to calm down, bringing ice in, so like giving people tools to where now they get it. And maybe the next time they have a flare up, because we're human and that happens, and, we have injuries, and then they're better equipped to handle that, right? And I don't know. I think that's where the power comes in. So while wanting so bad to make just this huge difference in the pain science, in the pain world, I think those are the little tiny things that we can do, and that's what trickles down. To your point, that's when that's when kids see their parents, they're like, what are you doing? And I'm like I have videos of Emmy Kate rolling on a foam roller when she was like, and I'm like, it's like they just get, or like if they see I have the cups out and and I'm
Yeah.
like, hey, Kelly Abram, I can't get that angle, and he's getting but like they see that, right? Much like they see you modeling, running, or eating healthy, or talking kindly to yourself, or whatever. They're seeing that and they're like, oh, I want to do that. So they're laying on tennis balls, and um, that's how we start changing, breaking the cycles. There's lots of cycle breaking happening, but for
Yeah.
our children to start talking to them about what their body might be doing. And, I mean, that's how things change, right? And if we panic at the first sensation of pain or whatnot, they're going to see that and be like, gosh, I got to, every time I tell mom I have my throat is sore, here comes an ibuprofen, or, that we're precipitating this pattern in their head of like, oh, well, I cannot feel pain without, you know,
Yeah.
medicating it, or,
Yeah. Yeah.
whatever. And so, um, I don't know. I think that's important. And I think that's a way that we start changing the narrative for the next generation of understanding more about your body.
Yeah, and so I'm reading our your points of
Oh,
like
yeah.
what we were going to talk about. That's what I was looking at. But yeah, so that was one thing I definitely wanted to touch on, what you said, the way we talk to ourselves and how we talk about our bodies, and take the pressure off. I'm just reading your text.
Yeah, yeah.
Take the pressure off of ourselves to diet or
Oh, yeah.
CrossFit or
Yeah.
be a runner, um, and just move
Right.
or, stretch. And that's something too, like for kids, there is that balance of um, age, development, how much you
Sure.
exercise, how aggressively you exercise. The boys are always like, "We want to lift weights with you," and we have a little workout
Right.
area in the house, and I'm like, "Okay, here's the 1 pound weight, or
Yeah,
here's the
yeah, yeah.
2 pound weights, right?
Right.
Like that's what you got for now." And so thoughts of like introducing that to kids, introducing stretching, introducing.
Yeah. Um, okay. Well, and one thing I'll say too is like, to that point of our little bullet points of when I'm giving like presentations about like stress management and self-care in general and like the things you can do, the take home message all is always, if you're creating such a complicated relationship with anything you want to change, it will not happen. There's going to be such a negative experience around it that you will figure out any which way to avoid doing it, right? So we need to stop trying a diet, yo-yo dieting, assuming that everything that's working for someone else is going to work for us. Our exercise does not need to be a full commitment that our children are seeing like, oh God, mom's a nightmare every time she's putting on her running shorts going to Orange Theory, but she keeps doing it. Like, is that what exercise is? But no, it's supposed to be fill you up in ways. So exercise with young kids looks like, hey, we're going to go walk around the block and we're going to scoot, you're going to do scooter, I'm going to do, those sort of things, and stop trying to make it fit into something that you're not connected to. And so you're just going to continue to set yourself up for failure, right? So like taking a few things that are really achievable for you and make those things your top priority, right? For little things about changing health, right? You know what? I can drink more water. And when I can do that, and that's such an easy thing, I don't have, and then when I do that, I'm amped up because I'm succeeding in something. And now I can like, now I have a little bit better control over like, hey, I am, fitness Claire with all this water I'm taking. And now I'm able to like do go on to the next thing that's like, hey, I'm going to set this goal for myself. So like setting goals that are super achievable and then not beating yourself up when you're not achieving those, and having open conversations with like your children like, I was really like, I really wanted to like go out and walk or go out and exercise and I didn't do it, and I just, that's kind of frustrating to me. Like having them see that you're, oh, that's frustrating, or or just anything like that, I think is really powerful and big. I think with kids, the number one thing is you've got a nervous system and a brain that is adapting rapidly. If you're doing one thing over and over again, that is a huge disservice. So all of the people who have decided, I'm playing this, my son is playing one sport, my daughter's doing gymnastics only, that is so detrimental to your child's development and their movement systems, right? And I always say like, you're let's take for instance, I mean, things that create an imbalance, right? Where baseball, right? Baseball's an easy thing. People start playing it year round. It's like, kids, 8-year-olds are playing like they're in high school. So this very unidirectional movement, I'm hitting one way, I'm throwing one way, and my body is getting very strong in that pattern. And that pattern serves me in no other aspect of my life except for baseball. So what happens when we're not playing baseball anymore? Or what happens when that 8-year-old is now a 14-year-old with a body so maladapted and so imbalanced in one direction? And then they decide, well, I'm really tall and I'm, this and I'm a pitch. And so even they've been so consistent about their pitch counts and their this and that, but now you've got a system that's so off, and then you're expecting this child to be able to do something because, oh, now they're old enough to pitch and do, and their system is not prepared for it. And there's an injury that occurs that is completely, you know,
Yeah.
not season ending, but game ending. I mean, and so the biggest thing with children is mixing it up. Their nervous system responds to different stressors. So any which way we can do, and it's funny because I started doing this with our little baseball team. So one of the coaches was like, "Hey, I saw this video about like generating power where you take like a medicine ball and they're not like swinging it, but they're like doing their swing rotation and kind of tossing the ball against the fence." And I'm like, genius. But we have to make sure they're doing it the other way as well. And
Yeah. Yeah.
he was like, what? Why? And I'm like, not because we want switch hitters, but because we want a balanced system.
Balance. Yeah.
Right. And so, like, that's the same thing. So, if somebody comes to me as a wellness client that really has nothing bothering them, right? The one thing that I'm doing is this assessment of a balanced system. So I have them do movement patterns in both directions, and right off the bat they're like, "Oh my, that's so much easier than this." And well, then guess what? Your homework now becomes thread the needle that way, because that way is really hard and your body for whatever reason is this way. And so starting to recognize our positions of comfort, right? And sort of unwinding out of them. And so I'm like, okay, if you sit and every time you sit, you cross your left leg over your right leg. Well, your homework is now cross your right leg over your left leg. But some people will be like, if I'm saying that during a lecture, they're like, they put their leg on the ground, they sit up straight, and I'm like, no, actually, that's not the answer. The answer is unwinding out of it, right? And
Yeah.
and so we all have positions of comfort. And what's interesting is when we are not mindful of what our body is feeling at any moment, we are going to those positions. Because there's a safety there. There's like a nervous system safety. I'm going to go back to that, right? And I always say the phrase, we become very comfortable in our dysfunction. So, you know, if I see like a little old lady and she comes in and her head's like this, and I'm like, let me guess, is your TV on that side of the room? And she's like, how did you know? And I'm like, well, ma'am, here you are now
Yeah.
adapted to your TV, right? So like recognizing the things that we do. Now, are we ever going to have a truly balanced system? No, we do things, we drive with our right foot, right? Like there are things that we do that set us up for an always imbalanced system. But if our goal and our homework and our self-care program, the undercurrent is about a balanced system, then we can prevent a lot of injury and a lot of things down the line by kind of creating that. So
Yeah. So, it's interesting about moving and creating a habit, right? Or
right,
doing something every day or as often as you can with your kids if they're not or even if they are playing sports, but if you
right,
can get outside with them or do something with them every day, so then you create a habit of, even if we're not in whatever season, we still know that we have to move. We have to,
right.
right? And so Jibby is in out of Cub Scouts and is into Scouts now,
Okay.
and he is working to rank up. And one of the tasks to rank up is for 30 days, run so every day for 30 days or as close to that as possible, run 1 mile, do
Uh-huh.
1 minute of sit-ups, 1 minute of push-ups, and uh, a stretching exercise to see how far forward you
Okay.
can stretch. And so we are I think we're 3 weeks in now.
Awesome.
Yeah, the only days he has not run have been the days he's had lacrosse games because usually they'll have 2 or 3 games,
Yeah.
and he plays most of the games. So I'm like, we'll let you
You
slide
ran
on
the
those
mile,
days.
right?
Yeah,
Yeah. Right.
but it's forced, and even though I do exercise most days, it's forced me to I've run most of these miles with him,
Yeah.
except like on the rainy days when he's done it on the treadmill, but even then I'm still
Yeah.
there. So like not only is it creating a good habit for him, but it's giving us some nice time together.
Right.
And then this really sweet, our neighbor down the street is so nice, and he's always out working in his yard. And so one day he said, oh, y'all are exercising a lot. Like, what's going on? And so Jimmy told him, and he said, well, what's your favorite charity? And poor buddy, he's like, it's St. Jude. Like,
Yeah.
and I'm like, oh, that's a good one. And he said, well, for every day you run, I'll give you $1 to give to St. Jude. And
That is
so
awesome.
we maybe not yesterday, the day before, I think, we saw him again. He's like, are you ready for the money? And I said, well, we're not done yet. He said, okay, well, when you're done. And then he said, well, if you keep doing it every day, I'll keep giving you $1.
Right.
I'm like, dang, Perry, that's amazing. But just to like even getting out, like not only for health, but socialization and so many other good benefits. And I have to say, as far as exercising goes, and this is another luxury item, but Peloton and the Peloton app,
App.
uh,
Yeah.
Jess Sims, I don't know if you've ever done her
Oh,
stuff, but she does, I don't think they do quite as much anymore, which is a shame. And I hope that they start doing more. But she has a series of classes called like
oh
Fit
yeah.
Family
Yeah. Yeah. Yeah.
Brain Breaks or Fit Family or whatever. And so it'll be fun little things like now we're a kangaroo and we're
Right.
hopping and
Yeah.
now we're this or that and starting with the stretch and ending with the stretch. And she always says, what does she say? I am strong, I am confident, and you have to repeat after her, and
Oh,
I'm
I
going to
love
make
it.
today a
Positive
really great day.
affirmations. Yeah.
Yeah, it's great. So just those little things though of keeping them moving,
Yeah.
that I think is so important, especially in the time of puberty when
Yeah.
bodies are changing.
Yeah.
And knowing and having these conversations too, that everybody's body is going to look different. And
Oof.
even though your body looks like this now,
Yeah.
in 6 months, in a year, in whatever, it might not.
Right.
um and so, and having these growth spurts of, sometimes they have the out growth spurt
Sure.
before they have the up growth spurt,
Right.
and then we
Right.
have, we talked about
Yeah.
body dysmorphia earlier. And yeah, but having those conversations with them to not dip into negative,
Oh,
them having a negative sense of self-worth, or body image, not using words like diet,
yeah.
not not restricting how much they eat, but focusing more on healthier eating.
Right.
Get the if you have the kid, I if you have the kid that's going to grab the junk every time, then just get the junk out of the house. I mean, or don't bring the junk into the house.
Absolutely. And I think it's such a balance. I mean, we were talking about just, breaking cycles. Um, and there's two components to that. One is body image in general, right? And this idea that we need to be constantly having conversations with our children, exactly like you just said, about people being different and that being wonderful, right? And that we're not saying things, even to our spouse, about the way we look, about the way someone looks, about, and any negative directed thoughts and ideas around someone's body and the way that their body looks, right? And, also, like, it's so hard. I've been trying to not, like, if I see a friend or I see mostly female clients, and like if there's a change in weight, Like, oh, you look so skinny. You're doing, what do you do? Like, you look like as if that's a, and it's like, your worth does not depend on how skinny you are, right?
Yeah.
Or like I'll say lots of things like, "Oh, you look like lighter energetically, like you look like you feel good or whatever." And using that kind of language, right? And looking at my children's bodies and I just love them and I want to squeeze. And I'm like, "Your body is so strong," right? Or like just, how do we
Yeah.
um change the narrative of like these body image problems and not being afraid of body exploration and knowing what body parts real names are. I mean, just all of that. And then also to create a new better relationship with food and not have it be something that is a fight or you can't have that, right? Like that, we got a lot of, you can't have that in my house. And guess what, when we were out of the house, we got it all, we wanted it all, we sought it out, we found it, and so like for us it's like if Kelly Abram is really wants something that's just kind of more sugary, right? Then I'll say, hey, you absolutely can have that. It's a weekend. So and so bought donuts. You can absolutely have that. We're also going to have like an egg or some bit of protein to counter that. So like,
Yeah.
right? I'm
Yeah.
not going to say you can't have a donut, right? Especially when I'm scarfing down two of them in, right?
Yeah.
Or and I don't want to create an issue where he's sneaking a donut or he's,
Yeah.
and so those sort of conversations, or like Dr. Becky says, it's like you're in charge of what's on the plate, you're not in charge of how much they eat on the plate. And like I've even had to like redirect, and this is all very well meaning, like Emmy Kate will come home, she's like, I made a happy plate, and I'm like, I don't want a happy plate. I want a happy belly. Okay. I don't need you to have a happy
Yeah.
plate. I need you. What is a happy plate is when your belly is so full and good and you feel energized and so we have kind of one rule in our house around what you're going to eat is we have a polite bite of everything on our plate, which I forget who, I think it was
I
Shelby
love that.
Worthington, if you're listening. We have a polite bite of everything on your plate. And what that means is someone has worked to prepare this. We've intentionally thought, hey, you should have a vegetable, you should have a fruit, and whatever protein or whatnot. And we put some thought into that. And then, you can do that. The other thing is we're not against like, you can have a cookie on your plate, right? And or if we do breakfast for dinner and Emmy Kate is like, I want that hash brown. I'm like, me too, sis. But I want you to like the hash brown is there. Let's not eat the hash brown all at once. Like, let's make sure we have a couple of bites of eggs and other things that we're
Right.
like. And so it just generates this like a better thought process about food. And like there's the girl Dempsey. She's so lovely and beautiful and overcome uh, eating disordered and stuff like that. Her big thing was like, put the cookie on the plate and say, yeah, you can absolutely have that as part of your dinner, and we're not going to eat the cookie first and only, but that cookie is fair game, as opposed to like, this cookie is your treat for making a happy plate, or,
Yeah.
like
Yeah.
this
And
sort of
even
like disordered relationship around things that are junky or taste good, and
yeah.
um
And I did
McCall.
a
McCall Manning Dempsey is her name. She's lovely. I don't know if you're
okay.
watching, McCall. Anyway.
I'll have to look her up. I did a live, I think it was last year with Ross Ford. I don't know if you know Ross, but
Mhm.
Ross was a chef. He's not in restaurants anymore, but he still
Okay.
does a lot of cooking. But we talked quite a bit about how we grew up with food and relationships with food and the
Mhm.
way we were taught about food and uh and what our and it was from what our parents learned from their parents, right?
Right.
And so breaking some of those habits,
Yeah.
and breaking use of some of this language,
Sure.
like you said, like
Like the
happy
happy
plate.
plate. Yeah. Yeah.
Yeah. um I I think is so important. We also use balance. So, like after church, if we if we make it to that 9 a.m. mass, which is like,
They always have
um,
donuts, don't they?
yeah, coffee
Yeah.
and donuts. But next to the donuts, they have orange juice, regular whole milk, regular milk, and chocolate milk. And so now you have sugar, sugar, sugar,
Do they have
sugar.
raw milk? I'm kidding. That's not funny. Just stop.
Here's my take on raw milk.
No, no, no. You
If
already
you're
gone there.
willing, I know, but like if you're willing to eat raw chicken, then go ahead with your raw milk, right?
Okay.
Because it's the same bacteria. But that's what I'll tell the kids is like if you want chocolate milk,
We're not
you can
also
have
going to have
chocolate
it.
milk.
Right.
Right. You pick
Yeah.
one. And that's what you get.
Yeah.
Because and I think that's a something that people and I talk about this in the ER quite a bit is focusing on what kids drink because I think a lot of people forget that that's
Yeah.
calories in too.
For sure.
And a lot of the stuff that you're drinking, like not only is it just empty, junky calories, but it's really icky for your body,
Yeah.
you
Yeah.
know,
Yeah.
in the inside.
Either lots of sugar or fake sugar or yeah. Yeah. Yeah.
Yeah, yeah. And I love when I hear like, well, I don't like water. I'm like,
Well, and I think that is such a product of like if you're child, and I don't know why Mary and I were very intentional about this right off the bat, but we don't drink anything but water. Like and with like the kids. And so even when I'm like, "Oh yeah, you can have juice," they're like, "No."
no,
Or like if there's a threat of a stomach bug and I'm like, "Everyone's drinking 100% white grape juice." I have no idea if that works or anything. But they're like, "I don't want this." It's an old wives' tale. I don't know.
I mean, roll with it.
But
It's not
but they're
anything that's
like,
harmful.
or like we never really even sat down and did a lot of milk past the like really early toddler baby stage. Um, so of course they like love water, and I think it just means that like if you started off and like
Habits. Yeah.
your water was in the form of more milk, your liquids were in the form of more milk or juice, then it's really hard to break that.
Yeah.
But let me say, children are so resilient. There's an uncomfortable initial period of it, but then they get it. And then they start recognizing that they feel better or I mean, that's the other thing we do a lot with our kids is like, Emmy Kate, she's like on fire, right? And we're like, okay, so the last couple of times we've seen that you've had a little sugar, we're noticing that you feel a little bit bigger. Your emotions are getting really big. I just want you to make note of that. Like, of course, she's, pissed as we're saying that, but
Yeah.
making those sort of assessments, like I did this with Kelly Abram with red dye, and I promise you, he picked up on it more than we did. So he would say, I would get like a Powerade Zero or something like that. And we've since done we've eliminated even those sort of electrolyte drinks. There's some better ones, but like I'll get Body Armor Zero and I'll put water in it. I'll kind of water it down, and that's a little bit different. But he was saying, he's like, one time I went to the store and I was like, "Oh, they only have like red. Do you want?" And he's like, "No, I don't want red. I don't feel good when I have it." And I was like, "What?" I was like, "Unpack
Wow.
that. Tell me about it." And he was like,
That's
"Every
amazing
time I
self
have a red
awareness.
Powerade after my soccer games, when somebody brings snacks, I don't feel good." And I was like, "You know what, buddy? You know what that probably is red dye." So we like talk about, and so fast forward, they had like a popsicle day at his school. And we do popsicles. We do like the Johnny Pops or whatever, the 100% fruit, although still with additives. And I saw everybody had a picture with a popsicle. And so I picked him up and he wasn't in a picture. And I was like, "Buddy, I saw it was popsicle day. Did you have a popsicle?" And he was like, "No, I didn't want one. I just didn't know if it was like all they had was red, or I didn't know if it was sugar free or something like that." And I was like, off on his own. Like I wasn't like, "You can't have popsicles." I lost you. I don't know if you're still there, but or maybe your video's like, I think Claire has talked long enough. So I'm just going to sit and wait until you come back. Maybe I'll be waiting forever. I think I lost you. Well, if this is the end, thank you for having me. I don't know if you're going to let me come back with all this chatty that I did, but I've loved being here, and I appreciate getting together with like-minded clinicians. So